Going to wait another minute or so because we're letting people in from the waiting room. We'll start in about a minute. Okay, I think I'm going to say hello. We're still allowing some people in, but we have a couple minutes of introductory remarks. So hello, my name is Helene Schoenbrunn. I'm on staff at the Westchester Jewish Council, and we're very happy to be presenting this session and collaborating with Columbia doctors on this very important topic. The Westchester Jewish Council is the central organizing body of the Jewish organizations, synagogues, and schools in Westchester County, and also reaches out to the 150,000 Westchester Jewish residents. A meaningful part of our mission is also to connect and strengthen relationships with other ethnic and faith-based individuals and organizations, as well as to the community at large. The council has been a vital resource to the Jewish community since the pandemic began, and are pleased to offer this Zoom meeting to the Westchester community at large on this very, very vital topic. So today we have with us Dr. Alyssa Ames Sikora and Dr. Maria Rozon, who both work at the Columbia University Clinic for Anxiety and Related Disorders in Westchester. Dr. Ames Sikora is a clinical postdoctoral fellow at the clinic, and she specializes in the assessment and treatment of internalizing disorders that affect youth and their families. Dr. Rozon is the postdoctoral fellow at the clinic, and she provides therapy for anxiety and related disorders. And now I'm going to hand it over to the doctors. Thank you so much.
Excellent. Well, thank you so much, Helene. I'm going to share my screen. Okay, can everybody see that okay? Is it big enough? Excellent. Okay, so thank you to the Westchester Jewish Council, including Helene, Lori, Pam, Donna, and Elliot, who helped coordinate this and put this talk together, and for Tugba from Columbia for your work in coordinating this talk as well. Hello to all of you who are here live, and for those that are watching virtually afterwards. Thrilled to be a part of this and joining your community. So we'd love it if you weren't feeling too shy, that you could turn your camera on so we can see you. Also, you can ask questions throughout this by putting questions in the chat box. You can address them specifically to Maria or I. We'll have a question and answer period for about 15 minutes at the end. If you prefer nobody to see it, you can just address it to us, or you can address it to everybody, but just be mindful that they'll be able to see you. So I am Alyssa. So I am a clinical psychologist, specifically a postdoctoral clinical fellow at QCARD Westchester. So we have two sites. One is in Columbus Circle, and the other one is in Tarrytown, where we are. And our staff works with kids, adolescents, young adults, and we also see some adults, though we often work on the younger side, dealing with anxiety and related problems. We do provide a range of services, from outpatient therapy, intensive outpatient therapy, and a day program for teens with anxiety and school avoidance. So we've certainly been doing a lot of work prior to this time, but definitely during the pandemic. And we are doing all of our sessions via telehealth. So I also want to share just personally, I have a toddler. I'm a parent myself. And so I've also been living it these past few months. It's tough. Um, so thank you for joining us. So our goals of today, when Maria and I were chatting about our agenda for this talk, a lot of ideas were kind of bantered about. There's so much we could talk about during this stressful time. But what we wanted to do is focus first on how to differentiate between what is kind of expected and what's more concerning behavior during a pandemic, because that's particularly kind of hard. That's what we've noticed from parents and other talks that I've given, that this is a hard thing to sort of figure out. Another thing is we wanted to really focus on how to take care of yourself first, and then the concept of what a good enough parent is. And then Marie's going to speak to how to support children and caretakers, and she's going to talk about a bunch of different skills and strategies for managing stress and uncertainty for caretakers and kiddos. And then we're going to provide a couple of tips and pointers about how to get connected to therapeutic services and provide a few different resources. We've have a wealth of knowledge of different things that we've used and different books and resources and websites and organizations, and we'd be happy to just kind of think through what could be helpful for your families. So, all right. So our lives have shifted drastically as the pandemic has changed everything about our day to day. The pandemic really breeds uncertainty, stress, and anxiety. Many of you are dealing with having to socially distance for holidays, for special events in our lives, dealing with fatigue for how long this is lasting. You may be dealing with a loved one, or someone you love having lost somebody. So dealing with loss and mourning, loss of identity through loss of work and resources. There's also, just with all of this change, there's a lot of emotion and confusion. So COVID is not a traumatic event per se, but it is a slow burn chronic stressor event. And chronic stress does tend to wear us out biologically. We can just be a little bit less equipped to continue coping with things. And then even as we move out of this, which we don't know exactly when that's even going to be, we're going to have some fresh anxieties about getting back to normalcy, whatever that will be. So how do we thrive? We don't have the best or even easy answers, but we're doing our best, at least as psychologists, but also as a community, to really put our heads together. And I hope, at least for Maria and myself, we're going to try to shed some light and guidance and reassurance that you're not alone. There are things you can do. You've been a caretaker. You've developed these skills over time. So, I when I think about children and teens in general and their development, I like to think of this botanical metaphor that comes from a book that Dr. Boyce wrote about how kids respond to stress. So the majority of kids are like dandelions. They respond adaptively to stress, and while it might take a little while for them to get used to a new setting, they go with the flow and learn. So this is like a dandelion because they're resilient. They can grow and flourish in the oddest places. However, there are some children that are more like our orchids. They're more susceptible and sensitive. They're delicate flowers. They require care. But given the right supports, an orchid can thrive just as much as a dandelion child. And I think this is important for us to remember as caretakers, as community members, that there are things we can do to kind of provide those supports. And for all of you that are entering, I think you probably know what kind of child and what kind of flower your child is. Are they the ones that need that more support, or are they more like a dandelion? But one thing that I think I definitely want to address is that for many typically developing children, I think we forget this, but they're incredibly good at learning, particularly when things are new. This is just something just biologically that they're sort of built to do. Quite frankly, they're a lot better than adults at doing it. As adults, we have the benefit of wisdom with age, but wisdom really isn't a tool that is going to serve us well when there's something as unprecedented as a pandemic. So what's so stressful for us is that we're really uncertain about what are the right exact tools to use. So I hope that we can kind of provide some reassurance, but also know that our children can learn and adapt. I'm amazed by the little 3-year-olds wearing masks as if it's just like a shirt or a jacket that they're wearing. So it's like they are learning, they are adapting. All right. So first off, what should we be concerned about as parents? What is normal versus concerning today? So, normal in regular times is hard to put a finger on. So, it's especially harried during a pandemic. So, a lot of this discussion, I want you to think about that behavior is on a spectrum from kind of normal to concerning. So there's not really as clear of boxes of like, yes, exactly, this is problematic. It's, I want you to think more about it as a spectrum. Um, and it's not always clear exactly how our expectations should shift because our children during this time are learning differently, socializing differently, just being in the world differently, and we're all a little less protected from social and emotional challenges. So expected behaviors now are very different than what they were last January, right? So what might we expect during a pandemic? Well, we might expect to hear kids and teens experiencing more sadness, maybe saying things like, I'm so sick of this. This is ruining my life. Outside of a pandemic, thoughts like this might sound extreme, but in a pandemic, this is the sort of thing that we are hearing. We're also going to expect to hear some irritability. So we know that children and teens show their sadness through irritability. And what this is going to look like, and what I hear a lot from parents, is a lot more ruder behavior, a lack of gratitude, more cursing, screaming and yelling. Any and all of these things are unpleasant for us, and we might feel like we have less capacity for it now. But that's kind of what we're dealing with during a pandemic. So you might also see a decrease or a change in social patterns because it's a lot harder to socialize now. Um, some may be seeing their friends less often or finding it hard to negotiate social relationships. Maybe their families have different, COVID safe behaviors and what they define as okay. So it's kind of hard to navigate that for some kids. They might also be socializing a lot more online. So, I think it's important that we're flexible regarding screen time and apps and, of course, appropriate monitoring, but be more flexible with outlets for socializing. Other things we might see, some decreased motivation. So school right now for many children and teens, it's very hard to stay on top of work and organization and feeling connected to school and your teachers and your schoolmates. And another thing that's happening is a lot of people are focusing on like the here and now and getting out of this period of time and aren't necessarily thinking about what's coming up next, like college. I don't think it's necessarily a red flag if your child is less interested in some activities. Just something to keep in mind that this is probably going to happen. A colleague of mine, like, talks about how his daughter, doesn't enjoy piano lessons as much as she did prior to the pandemic because it's over virtual, and you're not really connecting in the same way. It's not as easy to engage in that. So it's kind of, it kind of makes sense why you're not going to enjoy kind of virtual lessons as much. Another thing you're going to see is kids are on screens a lot. I get this question a lot too. Like, what is appropriate screen time use? It's already a main way for our kids to socialize, and now it's a main way that they're getting education. So I'm a big advocate, and I know my colleagues, and Maria is probably also a big advocate of monitoring online use. And another colleague of mine uses the metaphor of thinking about the internet as this public space. And would you allow your child to go alone to a park, which is a public space, alone and unsupervised? You can think about the internet in the same way as it is this, community space, public space. If you're going to accompany your child to the park, you want to think about accompanying your child and monitoring their use. Another thing we're going to see, especially from our teenagers, is increased risk taking and downplaying COVID risk. We see risk taking in teens in general, and this isn't to say that your kids should not be allowed to, or should be allowed to go out and do unsafe things, but these are just part of being a teenager. You're building independence, connecting with peers, and sometimes this does lead to increased risk taking and downplaying risks. It doesn't necessarily mean that they're in trouble or struggling or even that they're callous. It's just what we expect. So, I think it's helpful to think about what the hallmark criteria for depression and anxiety are. So if we're talking about depression professionally, what we're looking for is a persistent, depressed, down, sad mood. This is not just a day or two, but at least 2 weeks. And usually we're actually seeing it for quite a bit longer. And it's not just kind of like having a icky day or like a bad day. It's feeling really low for a significant chunk of time. We're also seeing a decrease in activities or a low interest in activities. It's either low interest or low pleasure. And this is a real downtick in involvement in some of these activities. It's not just like, one or two things, less having fun, having less fun in, but a real significant change. And then we might also see changes in sleeping and eating and a persistent pessimism about the future. I think this comes up a lot with teens. Um, if teens left to their own devices, you are going to see them kind of sleeping throughout the day, and maybe chowing down on a lot of stuff. So, try to think about this on a spectrum of, is this concerning? Um, can we get them back on a regular sleep schedule? Excuse me. So I put these there, and there are other symptoms as well to keep in mind. But I want you to think that it's not just one or two of these things. You might see this and say like, oh, well, my child or teen has experienced that within the past few months. But what depression really is a few these things together for a significant chunk of time to really for us to be thinking about a diagnosis of depression. Similarly with anxiety, what we're looking for are excessive fears and worries. So what we're thinking about, what questions that we're asking ourselves for problematic anxiety is a fear or worry getting in the way of school or family life, or are they causing distress over time? So there are some questions as a caretaker, as a parent, you can ask yourself to think through for things that may be kind of more problematic. So one question is, how persistent is this problem behavior? How long has this irritability been going on for? How much of the day is it happening? I work with a lot of kids that worry a lot, and they're like worrying like 80% of their days. It's taking up a lot of time. You're also going to think like, how persistent and severe is their lack of socializing? Um, or how persistent or severe is the motivation and this increased risk taking? Are they also able to maintain their academic demands? So they might not be doing as well, or doing quite as much as they were before, but are they meeting their marks? Are they doing some socializing, even if it wasn't as good as it was before? It might not be as wide of a social network, but is there something there? Do they have at least like one good friend? Usually as a psychologist, I'm kind of hopeful for the kids I work with to have at least one good friend. That's very protective to have one. um, you know are they also kind of shutting themselves in the rooms? Are they not engaging in family life? Really kind of ask yourself these questions. Are they engaging in any dangerous behavior? Any of these things, they're quite extreme behaviors, and they would be really important to follow up with a provider, particularly self-injury. So another question we ask, particularly for our younger ones, often, we're thinking about language milestones, social milestones, motor milestones. Are they meeting all of these things? I want you to also think about it for kids and teens as well. For instance, with teens, when we're thinking about develop milestones, we're really hoping that they build independence and autonomy. And so, in normal times, you might expect that they're sort of going to their teacher after class and asking them a question. Are they able to do that during this time? Is that something that we can do as parents to kind of support them, in kind of meeting those needs and meeting these developmental milestones? So I wish I had a list for you of things like, these are things you don't need to worry about, and these are things that are okay, but it is more nuanced. It is something I want you to think about in the spectrum. And so what do you do now with this information? How do you help yourself? How do you help your child? So even if they don't meet criteria for a diagnosis, it doesn't mean they're not struggling, right? So we'll also talk about, what does that mean for you? So, from one of the things I highlight for all the families I work with, all these presentations that I'm giving, is it's so important for parents to focus on themselves, and address their own anxiety so that they can communicate confidently with their children. It's sort of that metaphor of when the oxygen mask drops down when you're on a plane, you're told, put it on yourself before you put it on the child next to you. You have to be able to have any sort of steam and gas in your tank to be able to help them. You know, and Maria will talk about other ways to kind of do this. These are just some ideas, but you know, this is really an important piece. You got to take care of yourself to be able to take care of your child. And there is this concept of good enough parenting that I believe it's been around since like the 50s from Donald Winnicott. And you know, we all feel so much pressure to really be the perfect parent, to be like the best parent. You know, we want to see our children achieve the most they possibly can. So we have very high standards for ourselves and for our children. And, you know, I think it is very important to keep in mind that no child actually needs a perfect parent. You know, what they actually need is a parent that's, you know, well-intentioned. You know, they're kind of reasonable in the demands they give. They're pretty decent. They're self-forgiving. They're mindful about the coping model that they're providing. You know, we can't expect our children to be perfect. That's not a realistic expectation for living in this world. And I think what's also key is that we want to focus on our child's experience of childhood and as they're a teenager, being in the here and now. Because when we focus on the developmental tasks of the here and now, it sets them up for the future. So these are the ways that we can help our children. You know, we don't need to protect them from everything. You know, disappointment and discomfort are part of life. You know, part of the treatment for anxiety disorders is we're really kind of building muscles and tolerating discomfort and getting things wrong. And you know, that's a muscle we have to build. So the more we protect them, the more we're not allowing them to kind of build that muscle, kind of practice with discomfort and disappointment. So, you know, during a pandemic, it is okay to lower your expectations. And it's okay if you did during the spring when this first started and it's still happening because it's going on for a long time. All right, so now I will pass it off to Maria, my colleague, who will talk about the next slides.
Okay, hi everyone. Now that, you know, Alyssa has gone over a couple of really important pieces, you know, what's sort of typical and expected, what behaviors might seem, you know, much more concerning and might require some more help, and really also the importance of, you know, before we can really help someone else, really needing to take care of ourselves a little bit. And that doesn't mean, you know, just having a bubble bath once, but really consistently, you know, making some time, you know, each and every day for yourself, even if it's just 5 minutes. Once that's, you know, that's a difficult task. So don't underestimate how, you know, difficult that can be, especially with kids in the home and all the responsibilities we have. But that, you know, shouldn't be something that we forget about, because we are important as well. And I think, you know, your kids will appreciate that. The skills I will go over in the remainder of the time that we have, you know, I like to preface with, you know, these are not going to be groundbreaking new things that you have never heard of, right? A lot of the important skills I will go over are things that we all know about as being important things to do, but that are often just forgotten about, and that are maybe sometimes even just very difficult to accomplish when things are more stressful, right? We're all really stressed right now. We're going to be talking about how to help children with anxiety and stress, but really they're not the only people in this current world that are stressed and anxious. We all are. You know, their parents are, their grandparents are, their teachers likely are. So everyone is experiencing stress, and these different skills might, you know, seem very simple, but be very impactful if we're using them consistently. So initially, I think I'm going to talk a lot about communication. Part of that, of course, is listening and validating your child. And, you know, I think the term validation is often, you know, thrown around. You know, how often do we hear someone say, you know, just validate someone's feeling? But it's difficult sometimes, I think, to really understand what that means. You know, I think oftentimes, I think our impulse when someone, our child, our partner, our colleague, someone tells us about an issue or about a problem, about a negative feeling that they're having, we oftentimes just want to try and fix it, right? Our child is feeling really anxious about a particular homework, or about a particular test or about some fight they had with a friend. And it's difficult to see, our loved ones in distress. And so oftentimes we've got good ideas, right? We often, I think, especially as parents, think we've got a lot of life experience. I've been through this before, just do this and it will be better. And I think we're often convinced of just having having the truth or owning something, not owning, but sort of just knowing how to fix something. And so oftentimes we might just say, just do this, or I've been through that, just do X. And I think if we walk through our own conversations with other people, it's oftentimes helping us to feel much more supported and much more calm when someone just helps us understand that our feelings matter and sort of listens and has some curiosity about what we're saying rather than jumping straight in. And that's what I mean by listening and validating. So really just expressing that you understand what they're feeling, probably labeling their feeling. I think that's often the first step. If I had to sort of make it very structured, really with validation, you're labeling someone's feelings and making sure that they understand that that feeling makes sense, right? And that's an important distinction between validating how someone feels versus what someone does, right? I think oftentimes someone might get angry and slam a door, or might do something that really is, maybe not appropriate in the particular situation. And so what I'm trying to say is that it is okay to feel angry, right? In challenging situations, we all feel angry. Negative emotions are normal, and they will happen for each one of us. And we can validate that part, but not necessarily the slamming the door part or the behavior part that might be inappropriate, right? So when these conflict situations arise, it is, always important to make time to listen and validate someone's, your child's feeling, even if maybe you don't agree with that particular feeling, but really just saying something like, I get it, you feel angry right now, or I've been in that situation and I know how it feels, and really kind of pausing and just letting the other person, your child, your grandchild, whoever, it might be, hear that you get it, that it makes sense. I think what happens for many kids, really all of us, but thinking about kids specifically, is that we have negative feelings and we judge ourselves for them, right? Like, why can't I just get it together? Why can't I, just not be anxious about this test and just study and get a good grade and be done with things? Or, I'm sure you can think of sort of ways in which you judge your own feelings, regarding, maybe not feeling like a good enough parent, or feeling like you're, just feeling too anxious right now, or sort of just judging, the feelings that you have. And that necessarily, isn't really helpful. So what you want to provide for your child, even though it sounds very, very basic, is just that understanding that it's okay to have a bad day, to have, to feel badly, to feel anxious, to feel sad sometimes, and to just kind of verbally express that to them. You're feeling angry, I get it. And not just always right away jumping in to a solution.
Next slide.
Next slide, yeah. I'm realizing I have to sort of direct you to, okay, perfect. So in terms of communication strategies, right, we're all together now. I mean, most of us, I think, just spend a lot more time together, which, many people comment is a positive thing about the pandemic, that families have more time together because people work from home, children, do their schooling from home for at least some portion of the time. So, there's a lot, we always have this need to communicate appropriately to, get stuff done. But of course, right now, that probably is even more important. And so I have a couple of important communication strategies listed here, which again, are not going to be really revolutionary, but still very important, and important to kind of continue to think about, right? When we communicate with our loved ones, we often are feeling very stressed and maybe are just trying to get to the point, or just trying to fix something to get on to the next thing. But it is really important to remember that active listening is really important, and validating someone's emotions. And I already talked a lot about that on the previous slide. But, maybe just notice in your own lives when you, go home. I mean, when you sort of leave this talk, pay attention to how often maybe you are, speaking with your children, and are trying to fix a problem that they're having, rather than just listening and helping them just get it out, and helping them feel supported and validated, and that their feelings are okay. And then, try and respond with empathetic statements. Try and show them that you get it, and that you don't feel responsible to necessarily fix their problems all the time. One of the first steps to being able to fix a problem really is feeling supported and validated. So trust that if you give your children the space to voice their frustration, voice their emotions, voice their anxiety, and just kind of having an open ear for that, that they will get to a point where they suddenly feel calmer, right? I think we all get this, that we feel really stressed and anxious about something and have a space to just talk it out, and then suddenly feel at least a little bit calmer, even though the problem isn't fixed. But just getting it out there sometimes can be a little bit of a relief. And so you're in that moment, you're not doing nothing, you're really just giving them some space, and the necessary support to then get to that next step of problem solving and coming up with a solution to a particular problem. So you're being available for them to speak to you about how they're feeling can be very impactful. And it's sometimes easy to just forget that just being there, just showing up, just having an open ear is actually very important. Do you want to do the next slide, Alyssa? And so we try to be good communicators. We try to have things go well, at home when we talk with our children and all our loved ones in the home. But, there will be conflict. And so I want to talk a little bit about managing that. Because when stress levels run high, of course, there is more conflict. I think that's pretty normal, especially currently. And so I think, particularly when you're talking with your child, I think there will be situations where there's conflict because they just want something so opposite to what you want, right? Maybe they want to go out and see friends and you really don't want them to, or some disagreement like that. And sometimes it's just really difficult to understand someone else's perspective. So they might be really insistent on wanting to do X and you might see it completely differently. And that's when conflict arises, right? We each have our own opinion and we're really stuck to it, and we're the parents, so we think we're right, and they just don't know any better. And so, each person kind of just sticks to their own guns, and nobody comes together because nobody is able to just communicate about, what the issue really is, and maybe come to a solution. And then, conflict arises, and if conflict really gets to a point where you're no longer able to be calm, or your child is no longer able to be calm, it probably really then is better to just step away, to just take a quick break, say that you need a quick breather, 5 minutes, sort of make it specific, tell your child what you need in that moment to hopefully then come back with a different mindset and be able to kind of solve the conflict, right? Because if you just stay in that situation, of course, it is only going to get worse. Each person is going to get more and more angry. And so sometimes taking a break can be okay, as long as you kind of just make that really explicit and sort of almost model for your child. Look, I'm feeling really angry right now. I don't want to say things that that I might later regret. So look, I'm just going to go away for a second. It can wait. Let's talk about this later. There might be situations where that can't happen, but generally, I think I want you to spend some attention to thinking about your tone and your own feelings in these situations when you're communicating with children and family in general, and kind of just trying to emphasize that you have to remain calm to make these situations work, to make this communication go well. And really try and think about this idea of compromising, which I think is difficult for parents sometimes to understand, that you can compromise with a child, not in this way where I already know what I want you to do and I'm just waiting for you to accept what I want you to compromise on, but really allowing, sort of seeing your child as their own independent person who has, thoughts and wishes and feelings, and they're their independent person, and they want to have some agency, especially in this particularly difficult time. So for them, they probably, just like us, feel very much out of control, and giving them something that they can control is very important to help for their own mental health, for their well-being, but also for these conflict situations that will arise to kind of be solved and sort of be solved more smoothly. So really allowing, once everyone is calm, coming back together, really allowing yourself to see that, yes, you have the opinion about how to solve this problem, but your child has as well, and really coming up with a number of different solutions that might be helpful for this particular problem, right? They might be outrageous to you, but your child might have some reason for presenting a particular solution. Maybe they really want to go out with their friends, and they promise that they will wear a mask, and that they will only meet outdoors, and they will kind of abide by all of these safety precautions, but you don't feel that they should. You feel like they should just stay home, maybe connect electronically with their friends. This is just, a very simple example, and so there are a number of different ways to make the situation, work. Maybe sort of restricting the time frame that the child goes out, taking them there, picking them up. And so each person coming up with a list of different solutions to a problem, and then in the end agreeing on one, can sometimes just be helpful in, number one, giving the child some agency, having them feel heard, and also helping you see really what they're after, and kind of just working together in solving a problem. Of course, in the end, picking a solution is important, and then evaluating if that solution worked out. So coming together again after you did go out with your friends and I picked you up 30 minutes later and you only met outside, or whatever the situation was, or the compromise that you agreed on, really just figuring out, did this work? Did I stick to wearing a mask? Did I stick to the time frame? Or did something about this not work out? And maybe revisiting it and sort of figuring out why that didn't work and coming up with a new solution. So kind of continuously evaluating that. I guess what I'm really trying to have you guys take away from this is that it can be very, very important to just stay calm and really hear your child out sometimes, not having them feel like you're just trying to push some solution on them or some sort of opinion on them, but really hearing them out, giving them some agency, and really openly together deciding, what are we going to do about this? And that's, I think I said this, not always possible, but hopefully a little bit of a roadmap to managing some of these situations where we can find a way to make this work for the both of us, so we will both be happier. I won't get 100% of what I want, my child probably will not either, but we will both be able to communicate about this, which will improve our relationship and sort of both of our well-being in a way. Alyssa, do you want to hit the next slide? Perfect. In terms of communication strategies, really of course affect everyone, but I want to talk a little bit more about anxiety specifically, particularly the trap I think all of us parents get into is this trap of accommodating anxiety, anxious feelings, right? All of us parents feel pretty crummy when our children don't feel well, right? When our children are scared of something, feeling anxious, or really having any sort of negative emotion, I think the first hunch is to sort of rescue them and save them. And oftentimes, particularly with anxiety, while that is a really natural impulse, it isn't always the best solution, because the more we avoid anxiety provoking situations, of course, we in the end really just breed our anxiety. Anxiety kind of grows the more we avoid situations. That could be your child being afraid of social interaction. That could be your child being afraid of taking a really difficult test, or being really afraid to really any anxiety provoking situation you can think of. Oftentimes we as parents want to rescue our children, and it is important to just help our children face some distress sometimes, to kind of help them learn and understand, kind of like this muscle Alyssa was mentioning, this muscle that we have to build of tolerating some distress. just for the sake of not letting anxiety kind of grow into this, huge problem. So really helping your children find a way, supporting them through some of these difficult situations, not letting them skip things altogether, but really seeing if there is a way for them to encounter that situation and make room for some of their difficult feelings, and kind of helping them learn that they can tolerate some of that distress. And you can show them as well how to tolerate distress. Ellis, I think that's the next slide, right? Coping models. Do you want to go to coping models for a second?
Oh, this one?
There we go. That's something that, say that again? Oh, there we are. I think that's something that we often take for granted, right? All the, we try and sort of help our children think about what we can do to sort of actively help them feel better, feel less anxious, feel less sad, feel less stressed out, just be happier. One of the things that you do all the time is you exist around them, and you show them how the world works, and you show them what to do and how you manage difficult emotions, difficult situations. So don't underestimate how much you're being a role model for them. And that also means that you show them how you deal with stress, and you really want to try and be a coping model for your children by modeling for them, that experiencing anxiety, experiencing negative emotions is a normal thing, that you have those as well. You might show them by talking about some challenging moments that you've had, maybe at work, maybe with family, kind of walk them through, maybe not in detail that would be inappropriate, but letting them know, look, I feel really stressed out right now. I feel really anxious about X. You don't want to sort of load on them or make them sort of feel burdened. That's not what I'm saying, but really just labeling your feelings the same way that I spoke about validating someone's feeling by sort of labeling their feeling first. Really labeling your own feelings for them. It can help them feel really understood, or really not alone, right, with some of the stress that they might be going through. And as much as you're going to talk about, the way you're feeling, I think it's also important to show your children how you're coping with those feelings effectively. It is okay sometimes to not cope with feelings effectively, right? We all sometimes have moments when we don't handle a situation well. And even then, I think it's important to comment on that, right? Look, I don't think I should have yelled at you in that moment, or I don't think I should have said X, right? To sort of come back and say, look, I did this, I'm not proud of it, I'm sorry. So that's being a coping model. But, also if you are having a really difficult day at work, or you're feeling really stressed out about your loved one being sick, or the holidays not going the way that they should, any sort of anxiety provoking situation, if you sort of label your feeling and say, look, I need to take a breather right now, I'm going to go for a quick walk, or I'm going to watch this funny movie, or just presenting to the family, like, look, I need a break tonight, I've had too much and I need to do something fun. Would you guys play a board game with me? Or sort of just labeling your feelings, and also showing sort of different coping strategies that you might use, very simple things, but that you just use to help yourself to get through the day and to manage some of these feelings. Some of you might feel really interested in yoga, or sort of meditation, or deep breathing, or any sort of proper relaxation strategies that we often hear about. So if any of you use those strategies as well, I think it could also be cool to sort of openly talk about that, and sort of invite your children sometimes to maybe do them with you. They might find that really fun. Sometimes I think modeling as well that you don't necessarily know the answer to something can be really helpful as well, right? I think right now everyone sort of forgets to really live in the present moment and just accept that we don't necessarily know when this pandemic is going to be over. We don't really have many answers right now about stuff, and that is very unsettling. and just helping your children see that sometimes we just don't know, and it is okay. And it is okay to maybe live in the present moment and accept that this is the way things are right now, and that's okay too. That might be sort of a way to be a bit more mindful right now, when things just feel very stressful, and we're always looking to the future. It is sometimes much more settling to just live in the present moment and realize that that is okay. And I already spoke about some of these activities, and this really comes back to what I said at the beginning, that these different skills that I've mentioned are, they're not necessarily revolutionary, but sometimes I think families get into this habit of sort of just living side by side, and each person kind of going after accomplishments at work, accomplishments at school, and kind of just being busy all the time. That's sometimes glorified in certain ways, right? Just accomplishing things. When really right now, I think we're all trying to get by. We're all trying to just maybe make the best of it. And that is okay. And so having kind of coming back to some of these basics, family game night, reading before bed, just talking with your children, talking with parents, minimizing yelling and anxiety shaming, that type of thing can be really helpful. It is very helpful. I think I skipped that slide earlier when I was asking for to kind of go over some of the coping model stuff, that really consistency is very important for kids. And so this might be a perfect way that you can incorporate some consistency into this very unpredictable life right now, is to kind of just have a new schedule that kind of maybe changes on a daily basis or on a weekly basis, depending on who works from home, who doesn't, which kid is in school today, which kid is doing school from home today. Kind of just having a regular schedule and really having mundane moments like brushing teeth and showering and bedtime figured out, but also having sort of set times for family meals, which are really important for well-being. Having set times for maybe a family walk, a family game night, and kind of reincorporating things like playing board games together, watching, maybe movies on Friday, pizza night, something like that, just stuff that brings the family together. And, depending on how old your child is, they may not necessarily always be open to that, right? I think especially people who have kind of emerging teenagers or teenagers at home maybe notice that they try and withdraw a little bit more and don't want to join these activities so much. So don't necessarily push it. I think sometimes when you just start these behaviors and the rest of the family is having fun together, sometimes kids tend to come around and maybe at least stop by or sit near some of these activities and kind of try and be engaged some other way. So I don't mean push some of these things on your children, but maybe just try and incorporate the stuff that might be fun, and really have a dedicated time for it, and don't skip it week to week, just to kind of emphasize that, family kind of bonding is very important as well, and that it will allow for these natural moments of support between family members. So for the sake of time, I think I'll skip this slide. It's just really summarizing what we've talked about so far. And I really wanted to end on this this important slide. It's coming back to something Alyssa said earlier, is that, you guys, all of us as caretakers, have really practiced our entire lives for this moment, right? We've always, in some way learned how to take care of someone, and you've been a parent for some time. And so trust that you can take care of yourself as well as your loved ones and your children. And that success isn't necessarily something that kind of like this first arrow shows, right? Sort of like goes up and up and up all the time. I think success is much more, what we see is that success sort of moves in this weird curve that the second arrow does, right? It goes up and down. There are days where nothing works out, and maybe the next day nothing works out either. But over time, you are kind of working towards something and getting better over time. So really trust that you have the necessary skills as a parent, as a caretaker, to do this right. Hopefully there were some helpful kind of pieces in this talk to help you figure out how to get back on track or really maybe even improve, on some of these skills.
Excellent. Thank you, Maria. So very quickly before we jump into the question and answer period, I have there is a wealth of really fantastic resources out there. New York Presbyterian Youth Anxiety Center has continually done webinars similar to this type of topic, some specific for young adults. And I see that there is a specific question about young adults. So, I would really kind of encourage you to search. It's on YouTube. Search this, and if you're having trouble looking, you can contact me and I can send this to you. Anxiety Canada. So even though it's not in the US, it's a fantastic resource. There's lots of different organizations we're a part of, but we often work with ADAA. They have another really good resources. I really like this newsletter from Children's National, and I'm biased. I used to work there, and I really love it there. And I've been very impressed with some of their newsletter things. And then, outside of the pandemic, I have found that these books are really helpful for anxiety and parenting children with anxiety specifically. And then these have been, I believe they're both created by the APA, the American Psychological Association, but they're both free resources. And I think they're particularly targeted towards younger children. And then you don't have to go at this alone. I will kind of rush through this, but you can go through your insurance company to find in-network providers, or you can go through kind of different organizations like the ones I've listed there. They have Find a Therapist service, and you can kind of look in for your criteria. If you want to see a man versus a female therapist, you can look into some of these things. But very many people are kind of doing telehealth services. And there are even laws where we can practice outside of our own state, at least temporarily, while we're under, like, I forget what they call it. But so we're here, we're available. And specifically at Q Card, Westchester, we are seeing patients. January is a particularly busy time. It's a stressful time for a lot of families. So I've included our intake line, and we're also going to be sending these slides so that you can access this and see these links. This is my email, and then this is Maria's email. So I believe, is that right, Maria? Is that your email?
Yeah.
Okay, great. So you can also contact us that way. And then we can kind of jump into questions and comments. Let me unshare my screen. How do I do that? Where is that? There we go. And we have gotten a couple of questions already so far. And there's one question about basically, like, do we kind of cut off online socializing, or what do we do? And I would love to hear Maria's thoughts, but kind of what comes across in this question to me is I actually lost my thought for a minute. But what comes across is that we have a new stressor. It's not like we haven't been stressed, but there's a new, there's always new stressors. And as psychologists, we're not in a really position to provide specific guidance about, like, what is COVID safe behaviors, or how do you act, or like, what do you do? Usually what we try to do, at least for patients, is kind of get them to be like what the CDC recommends, but really we work with the family to find out what are kind of their COVID safe behaviors that they want their kid to work towards. If they're feeling too anxious, for instance. So, but yeah, so I don't think we could speak specifically to, like, what do you do? How do you get them connected? But I think, in terms of online socializing, I think it can be important to be flexible about what kind of online socializing they're doing. If you feel like, you can kind of safely monitor, depending on kind of their age, like what they're doing, maybe that is the way that they're interacting with their peers. Maybe, I've been really impressed with peers and the like strategies they've used to connect with each other, like the games that they can play through some of these apps. So I think it's also be creative, look online for other resources, kind of branch out besides like doing one thing, but also be careful, like connect them with kind of their current peers. And I think the red flag thing to look out for is, like, how much are they connecting to strangers? There's a lot more before. Is there any unsafe things? So just be mindful, and this is where kind of monitoring comes in. Is there any other thoughts you had about that, Maria?
No.
Okay. And then another question we had was, dealing with adult children. So there's actually this, when they're at home. And so like, I guess what comes across is like, are some of these things that we're suggesting, Maria and myself, like, are they relevant for adult children? This is a technically kind of a new developmental period called emerging adulthood. I think it was sort of first written about in the 90s. But it is true that emerging adults don't yet have a fully developed frontal lobe part of their brain, which is where a lot of our, I'm going to go really, I hope I don't get to using too many psych words, but the part of their brain where they're organizing and thinking complexly about things, planning, it's not fully developed until they're kind of in their mid-20s. So emerging adulthood is still a period of time where our children are still developing. There are ways that we can support them. We just have to be mindful about what are the developmental tasks of this period of time. Emerging adulthood, it's probably still like identity. It's probably still like, like, what kind of career am I interested in? How do I get that started? Really kind of even more so than adolescence, building that independence, going to doctor's appointments for the first time by themselves and asking questions. So kind of helping support them through kind of building that independence. And what we generally recommend is kind of doing it gradually and thinking about even starting that early on if you have children that are going to be kind of more adults soon. But also be mindful that, like, they might put off things like college because they don't want to have to attend college virtually for the first time. A lot of people are doing that. So I think it's just being flexible about expectations. And this is, I think, where that concept of good enough parenting comes in. You're not going to have the perfect answers, right? And this is also where the coping model comes in. You're not going to know exactly what to do. And sometimes not knowing and kind of just talking it through and problem solving, your child being a part of that or seeing you do that builds that skill for them. So Maria, any thoughts about that, supporting adult children living at home?
Especially adult children right now, their lives probably right now are what they expected to happen is to, maybe finish school, maybe start a career, maybe go to college. They probably had all these expectations for themselves that would have been possible in this sort of previous world. And now with pandemic, things are probably quite different. Maybe they're not able to attend college physically, even having to live back home when that wasn't originally the plan, that might be challenging. So, I think maybe the validation piece, still holds true, right? How annoying is it that is currently their reality? So validating that could be helpful. I'm sure you're all already doing that, but really maybe doing that more. And then also maybe sometimes giving them some space and really allowing them to have some, well-needed space to just kind of sort things out for themselves if that's what they want. I don't, everyone's preferences might be different, and that's a tricky age when really, usually people seek a bit more distance from family. So that might be very normal, very appropriate, and they, should have the right to some more privacy if possible.
There is another question about different rates of things increasing, like bulimia or anorexia and cutting, which is that self-injury thing I was talking about. As a clinician, I see things particularly in my patients. So I'm paying attention to kind of what's happening and like a epidemiological thing, which is like, how much are these rates increasing? But I can't speak to this like as an expert in terms of like rates, but I think anecdotally there is an increase in this, but I think what it's coming from is just chronic stress. And if we're thinking about kind of, just the toll that stress can take on our bodies can be pronounced. So, if you're noticing any sort of concerning signs about this, this would be especially with these questions of an eating disorder and cutting. These are extreme behaviors that you definitely want to kind of reach out to your providers, and sometimes that could be like first step is pediatrician, get that appointment right away, get a referral. But yeah, and I think there's other things that are also increasing too. But it's we have to be mindful about our children and the spectrum of behaviors and what is more concerning. Anything you want to add to that, Maria?
No.
Okay. These are fantastic questions. I'm really impressed. We have a minute longer. I do like this question about kind of screen time and like, what do you do? And I can't speak to your specific circumstance. I think it sounds like it's potentially pretty complicated, but in general, for like video games and online socializing, what can, you know, what I tend to work with my families is, let's use the things that they enjoy to our advantage, use it as a reinforcer. But if they're kind of really rigid and only doing one thing, really think about how to kind of adapt it to expand what they're doing. So there are, I don't know what they're called. I'm not really very good at video game knowledge, but there are different kinds of games where you are socializing with your peers. I think Minecraft is one of them. But there are ways that you can kind of maybe add in the socialization piece, or you can kind of create limits, but then use it as a reinforcer for doing other things. But it is definitely a challenging thing to navigate, and there are some good advice about screen time and that sort of thing. I'm trying to see if there's anything else. So it is 1 o'clock. I do want to say I got a question about slides. We are gonna be sending them as well as this is being recorded. So you will have access to these things to see them and get these resources that we shared. But thank you for joining. I think Helene wanted to say goodbye.
Well, thank you so much, Doctors Ames, Sakara, and Rosen. It was very, very valuable information that you shared, and also very important to many of us during this difficult time. I hope everybody got a lot out of this, and we hopefully will continue providing the community with other important resources in the future. And thank you so much, everybody, for attending. We will be sending a link to a recording of this to all people who registered, and you can share it with others as well. Thank you so much. Take care. Have a good day.
Thank you, everyone.
Thank you.